Hi, I'm Glenn Heffley, and I'm here to talk about the rising costs of healthcare in the United States of America. In 2014, approximately, the United States spent $3.8 trillion on healthcare costs, roughly about 18% of our GDP. Our pharmaceuticals were responsible for $1 trillion in the same year, exceeding about 26% of that total healthcare expenditures. Now, these costs are expected to continue to climb over the coming decade, despite the Affordable Care Act, as well as other measures that have been taken to reduce the cost of healthcare, improve the quality of healthcare, and also to address patient outcomes. Big Pharma, or Big Pharmacy, if you will, is a major contributor to national healthcare costs and is an area where significant changes can be made to reduce our out of control spending. I'll be discussing two major ways that Big Pharma has driven up costs and spending on pharmaceuticals. One of those is through marketing, directly to the consumer as well as to the physician, as well as different pricing structures that have been designed to maximize profits on pharmaceuticals. But let's keep it simple and let's start with our marketing, okay? Let's talk about direct to consumer marketing. Roughly 90% of the commercials that you'll see on the nightly news or the network news broadcasts are primarily driven by pharmaceuticals, be it prescription drugs or over the counter drugs. Now, patients are asking their doctors for these drugs despite knowing what they're all about. For example, when Viagra first came on the scene, women were going into their doctors and asking for their free samples. Didn't quite work out quite right. Now, in 2007, Pharma spent over $3 billion on direct-to-consumer advertising alone. And I will tell you this, those costs have increased in recent years. Now, the direct-to-consumer cost is just a fraction of the overall marketing cost for Big Pharma. In comparison, the same year, 2007, physicians marketing to physicians, including lunches, trips, promotional materials, and samples, totaled over $24 billion, according to some experts. Now, considering that it costs approximately $1 billion in R&D costs for every successful pharmaceutical drug that reaches shelves, and there are only approximately 20 to 25 of these drugs that hit the shelves every year, that means that the cost of marketing to physicians alone has actually exceeded the cost of research and development. In recent years, however, 12 states have begun putting limits on how much a physician, hospital, or clinic can receive from pharmaceutical reps. In fact, many companies have begun prohibiting the practice as well. I work for Group Health, and there are actually limits that you're allowed to accept from a pharmaceutical rep, limited to like pens or stationery or something like that. Anything else beyond that is out of bounds and considered unethical. Marketing to consumers and physicians has had a significant impact on the cost of pharmaceuticals over the last few years. But there's another factor that needs to be addressed. And that is, it has a very dramatic effect on pharmaceutical costs, and it's the pricing strategies. One thing that is important to know is that the high R&D costs that we just discussed just a moment ago for pharmaceuticals are sunk costs, and they must be collected from the sale of the drug. Now, you add that to the marketing costs, which are inflated, like we've just discussed as well, and the actual manufacturing costs, which are minimal, they are all added into the cost of the drug. Now, upon initiation of the drug into the market, prices are low to try to get people to start using it, kind of an introductory price, if you will. And after the product has become established, prices are raised to maximize the profit during the main run of the pharmaceutical drug before cheaper generic alternatives are available to hit the market. Now, at a predetermined time before the introduction of generic drugs, prices will increase once again to absolutely maximize and get every dollar out of that drug before competition comes in to take away a substantial amount of their profits. This particular pricing strategy is designed to maximize profits at the expense of the consumer. Not saying that getting a profit is a bad thing, but I'm saying that when it's at the hands of the consumer that needs it, might be a little bit of an ethical issue there. Pharmaceutical companies have been known to slightly alter their formulas for drugs shortly before generics hit the market to extend their profitability. I've got a couple of examples for this. One of them is Nexium, which had one ingredient altered stripes placed on the purple capsule, and was remarketed as Prilosec, one of the most profitable drugs of all time. The next is Prozac, for example. Change the color of the pill to green instead of pink, I think is what it was, and market it as a drug to treat premenstrual symptoms for women. And it's made a whole bunch more money since then. It came out right about the time that the patent was about ready to expire for Prozac. What it all boils down to is this, that pricing strategies for pharmaceutical drugs are also partially responsible for driving up the cost of pharmaceutical drugs. So let's take a review, shall we? Healthcare costs in the U.S. are high, responsible for 18% of the gross domestic product. Pharmaceutical costs are responsible for 26% of those healthcare costs. There are multiple factors that drive up the cost of pharmaceuticals, including marketing to consumers as well as to physicians, and also the pricing strategies that are used to maximize the profits for drugs during their commercial run. Now, here's my recommendations for how we can lower the costs of pharmaceuticals. 1. Ban television marketing for pharmaceuticals. It's an unnecessary expense that drives up the costs of pharmaceuticals for those who desperately need it. Second, limit the kind of marketing that is done directly towards physicians. Driving sales by giving away expensive trips or gear to doctors like drivers or golf clubs is unethical, and it's wrong. Doctors do need to learn about the medications, but their decisions to prescribe a specific drug should be due to what will be most effective for the patient and not what is most profitable to their wallet or to Big Pharma's wallet either. Now, another thing that we can do is limit the pricing fluctuations for pharmaceuticals to prevent price gouging. Now, while these strategies will probably only have a minor effect on the overall pharmaceutical pricing and just a minor effect on the overall pricing of healthcare, when we're talking trillions of dollars each year in healthcare, just a few dollars savings can actually mean the whole world. Thank you. I'm James Glenn Heffley, and thank you for your time.